But the problem is to find a way where we really understand how the patients can integrate the treatment within his or her life and make it something acceptable and manageable.
And you pointed out that different patients have different results with the same treatment, and it's a function of their behavior. And that therefore they should be approached differently. And of course, at Observia, we talk about behavioral diagnostics and using digital tools to carry out those behavioral diagnostics. And I wanted to ask, what have you seen these last couple of years in terms of tools to do that behavioral diagnostic that you find to be interesting?
So, to the point of the behavioral diagnostic, I think what digital is going to help us doing. And when you talk about behavioral diagnostic, it's dragging us out the idea that if something doesn't work, it's because the patient is not doing things properly. The problem is that the misconception is that if things don't work, the treatment is perfect, the patient is imperfect. Well, we are all imperfect, okay? That's fine. But the problem is to find a way where we really understand how the patients can integrate the treatment within his or her life and make it something acceptable and manageable. So in terms of tools, of course, the most advanced things have been developed, I would say, in the space of diabetes. And in the space of diabetes, where the link with digital actually came quite naturally, because you need to register data, you need to manage your data, your blood glucose measurements. And also, a lot driven actually by the type 1 diabetes community, managing the carbs and helping people to also fit their life, their activity, their food with the treatment, and how you can manage a better outcome, which for the patients is like, being in the right range. So we have seen things, and we're working with OneDrop. So I'm going to tell you, it works very well, and it does actually works very well. And it has this aspect of being, a bit less top down, but much more focused on the patient and how you integrate with the life.